The hardest part about high blood pressure is that the damage often begins long before anything feels wrong. A stroke can seem sudden. A heart attack can look like it came out of nowhere. Kidney problems may appear to develop later in life almost without warning. But in many cases, the process behind those events has been building quietly for years. I'm Dr. Warren Hung. On this channel, I help you understand how the body changes with age so you can protect your health before small problems turn into much bigger ones. If that kind of practical, medically grounded explanation is helpful to you, consider subscribing. One of the most dangerous misunderstandings I see in adults over 60 is this idea that if blood pressure were truly serious, you would feel it. You would feel headaches. You would feel dizziness. You would feel something. But that is not how high blood pressure usually behaves. In fact, one of the ugliest truths about hypertension is that many people feel perfectly normal while it is quietly damaging some of the most important blood vessels in the body. That is why clinicians often call it a silent condition. Not because it is rare, not because it is mysterious, because it can do harm for years without creating symptoms strong enough to force your attention. And that becomes more dangerous after 60. When you are younger, the body has more reserve. Blood vessels are usually more flexible. The heart can tolerate strain more easily. The kidneys often compensate better. The brain can sometimes adapt more effectively to circulation changes. But as the body ages, that reserve shrinks. Arteries naturally become stiffer over time. The heart has to work harder against pressure than it used to. Kidney filtration becomes more vulnerable. The brain becomes less tolerant of reduced or unstable blood flow. That means the same blood pressure reading that may have caused modest strain at 40 can carry far greater consequence at 65 or 70. And this is where many people get misled. They assume that because they have lived with a little high blood pressure for years, and because nothing dramatic has happened yet, it must not be doing much harm.
Because at
But
that
blood
stage
pressure
of life,
damage
you are
usually
no
does not
longer
work like a
dealing
dramatic
only with
event.
pressure itself.
It works more
You
like
are dealing
repeated
with
mechanical
pressure
stress.
layered on top of
Imagine
aging
bending a
blood vessels,
paperclip once.
aging kidneys,
Nothing happens.
aging heart muscle.
Bend it again. Still fine. Keep bending it over and over, and eventually the metal weakens and breaks. Your arteries are not paperclips, of course. But the principle is similar. Constant elevated pressure places repeated stress on the lining of blood vessels every minute of every day. Over time, that strain changes the structure of those vessels. It affects how flexible they remain. It affects how well they regulate blood flow. It affects how vulnerable they become to plaque buildup, clot formation, rupture, and narrowing. And because this process is gradual, many people never connect the damage to the blood pressure that helped create it. They treat stroke as bad luck. They treat kidney disease as just aging. They treat memory decline as unavoidable. They treat heart enlargement as something that simply appeared later in life. But often, elevated blood pressure has been part of that story for years. Another problem is that many older adults rely on how they feel as their safety signal. If energy is decent, if there is no headache, if there is no chest pain, if daily life feels normal, they assume things are stable. Feeling normal is not the same as being protected. Blood pressure is not like touching a hot stove, where the body gives immediate warning. It is more like water slowly wearing down stone. Quiet, gradual, easy to ignore until the effects are already substantial. And that is why this topic matters so much after 60. Because at that stage of life, you are no longer dealing only with pressure itself. You are dealing with pressure layered on top of aging blood vessels, aging kidneys, aging heart muscle, and reduced physiological reserve. The body has less margin for chronic strain. Small, ongoing mistakes matter more. Delayed action matters more. False reassurance becomes more dangerous. The ugly truth is not simply that high blood pressure raises your risk on paper. The ugly truth is that many people live with meaningful vascular damage building inside them, while believing they are fine because nothing hurts yet. And by the time symptoms finally appear, the conversation often changes from prevention to damage control. But to understand why high blood pressure can stay so quiet while doing so much harm, you first need to understand what that pressure is actually doing inside the body every moment it stays elevated. To understand why high blood pressure can be so dangerous, you first need to understand what that number on the cuff actually means. When your doctor says your blood pressure is elevated, they are measuring the force of blood pushing against the walls of your arteries. That pressure is not inherently bad. You need pressure to move blood through the body. Without it, oxygen and nutrients would never reach the brain, kidneys, muscles, or other organs. The problem begins when that pressure stays too high for too long. Because blood vessels are not rigid pipes. They are living tissue. They expand. They contract. They respond to hormones. They adapt to changes in blood flow. And when pressure remains chronically elevated, those vessels are forced to operate under strain they were not designed to tolerate continuously. Think of it like overinflating a garden hose. If pressure runs slightly too high for a brief moment, the hose can handle it. If the pressure stays elevated day after day, year after year, the material begins to weaken. Your arteries behave in a more complex way than a hose, but the same basic principle applies. Persistent excess pressure creates wear. The first place that wear often begins is in the inner lining of the blood vessels. This lining is called the endothelium. It is a thin, delicate layer of cells that helps regulate blood flow, vessel relaxation, clotting behavior, and inflammatory responses. When blood pressure stays elevated, that lining experiences repeated mechanical stress. Tiny injuries can develop, and while those injuries may not create symptoms, they matter. Because once the vessel lining is repeatedly irritated, it becomes easier for inflammation to develop. It becomes easier for cholesterol particles to penetrate the vessel wall. It becomes easier for plaque to build over time. That is one reason uncontrolled hypertension and atherosclerosis often travel together. High blood pressure does not just coexist with plaque buildup. It can help accelerate the environment that allows plaque to form and worsen. But the blood vessels are not the only structures under stress. Your heart is also forced to adapt. Every time the heart pumps, it must push blood against the resistance inside your arteries. If that resistance is elevated, the heart has to generate more force to do its job. At first, the heart compensates. It works harder. It thickens its muscle. It maintains output. Many people assume that a stronger heart muscle sounds like a good thing. In this context, it is not. When the heart muscle thickens because of chronic pressure overload, that is not healthy strengthening like exercise. It is strain adaptation. The heart wall can become stiff. Filling becomes less efficient. Relaxation becomes harder. Over time, this can contribute to heart failure, rhythm problems, and worsening cardiac performance even before someone has a heart attack. And again, this can happen quietly. The kidneys are another major target. Your kidneys contain tiny filtering units supplied by delicate small blood vessels. Their job is to filter waste, regulate fluid balance, and help control blood pressure itself. But those filtering structures are highly sensitive to pressure. Chronically elevated blood pressure can scare and damage them over time. This is one reason hypertension is one of the leading contributors to chronic kidney disease. And the relationship becomes vicious. Because once kidney function starts declining, blood pressure often becomes even harder to control. The brain is also deeply affected. Your brain depends on stable, carefully regulated blood flow. Too much long-term pressure can damage small cerebral vessels, increasing the risk of stroke, mini-strokes, and subtle circulation changes linked to cognitive decline. This is part of why some people develop gradual vascular memory impairment later in life without realizing blood pressure may have contributed for years. And one of the most important things to understand is that the body often adapts to elevated pressure enough that you stop noticing it. That adaptation fools people. They assume, my body must be handling it. I've had high readings for years. If it were dangerous, I'd know. But adaptation is not protection. The body can compensate while damage continues underneath. That is true in many areas of medicine. A person can adapt to worsening blood sugar before diabetes complications appear. A person can adapt to declining kidney function before symptoms become obvious. A person can adapt to poor sleep for years while cardiovascular strain builds. Blood pressure works the same way. The absence of obvious symptoms does not mean the body is unharmed. It often means the body is compensating, and compensation has limits. Eventually, the strain becomes greater than the reserve available to manage it. That is when consequences begin to surface. A blood vessel narrows enough to matter. A plaque ruptures. The heart stiffens enough to create symptoms. Kidney filtration declines enough to show on labs. Brain circulation changes enough to affect cognition. And when those effects finally become visible, many people assume the problem has just started. It usually has not. It has often been building quietly for much longer. That is the real biological ugliness of hypertension. It does not merely create a bad number. It creates cumulative wear across multiple organs at once. The heart, the kidneys, the brain, the blood vessels themselves. And it often does so while the person carrying that risk feels completely normal. Yet one of the biggest reasons people still underestimate high blood pressure is because they trust their symptoms more than the biology, and that false reassurance is where many dangerous mistakes begin. One of the most common things patients say when we talk about blood pressure is, "But I feel fine." And I understand why that feels reassuring. In everyday life, symptoms are how most people judge whether something is wrong. If your knee hurts, you notice it. If your stomach is upset, you notice it. If your back is injured, you notice it. So it feels intuitive to assume that if blood pressure were truly dangerous, your body would alert you somehow. But blood pressure does not follow that pattern. High blood pressure can remain significantly elevated while producing no warning signs at all. No headache, no dizziness, no chest pain, no obvious sensation that something harmful is happening. That is why relying on symptoms to judge blood pressure control is one of the most misleading habits older adults fall into. A patient in his early 70s once told me, very confidently, that he could feel when his blood pressure was high. He said on days when he felt pressure in his face, mild headache, or stress, he assumed it was elevated. On days when he felt normal, he assumed it was under control. When we compared those feelings to his home blood pressure log, the pattern did not match at all. Some of his highest readings occurred on days he felt completely normal, and some of the days he felt high were not particularly elevated. That illustrates something important. How you feel is often a poor indicator of what your blood pressure is doing. Now, this does not mean symptoms never occur. Very severe blood pressure elevations can sometimes cause headaches, blurred vision, chest discomfort, shortness of breath, or other symptoms. But ordinary chronic hypertension, the kind that slowly damages blood vessels over years, often causes none of that. And this creates a dangerous psychological trap. People begin trusting comfort over measurement. They think, I slept well, so it must be fine. I feel calm today, so it must be lower. I have no headache, so it cannot be that high. I would know if something serious were wrong. But comfort is not a blood pressure test. The body is remarkably capable of functioning under strain without sounding an alarm. That is especially true when changes happen gradually. If blood pressure rose from normal to severely elevated in a matter of seconds, you would likely notice. But when it creeps upward over years, the body adapts along the way. That slow adaptation makes the abnormal feel normal. And that is where people get fooled. They confuse adaptation with safety. They assume, my body has adjusted. I'm used to it. It's normal for me. Clinically, normal for me can be one of the most dangerous phrases in medicine, because many harmful states become familiar before they become obvious. People get used to chronic fatigue. They get used to poor sleep. They get used to elevated blood sugar. They get used to shortness of breath they blame on age. And they get used to blood pressure numbers they should not be comfortable ignoring. Another reason this false reassurance is so common is that blood pressure is often framed too casually. People hear phrases like, it's just a little elevated. It's not terrible. We'll keep an eye on it. A lot of people your age have high blood pressure. While sometimes said with good intentions, those phrases can create the impression that elevated pressure is simply a routine part of aging rather than a real physiological burden. Yes, hypertension becomes more common with age. No, that does not make it harmless. Wrinkles are common with age. Reduced hair density is common with age. Joint stiffness is common with age. Chronic excess pressure damaging blood vessels is not harmless simply because it becomes more frequent later in life. Common does not mean safe. And another false reassurance many older adults rely on is the idea that my numbers are only high at the doctor's office. Sometimes that is true. White coat hypertension is real, but many people use that explanation too quickly. They dismiss repeated elevated readings without ever checking properly at home. They assume the problem is anxiety rather than physiology. They postpone monitoring because they prefer the explanation that feels less threatening. That delay matters. Because every year uncontrolled pressure remains elevated is another year of cumulative strain. This is why clinicians focus so heavily on trends, home monitoring, and repeated measurements rather than asking how someone feels. Because blood pressure is not judged by sensation. It is judged by objective readings over time. And this can be frustrating for patients because it means your internal sense of reassurance may not match the medical reality. But that discomfort is important, because the ugly truth is this. Many people who suffer the consequences of hypertension felt healthy until shortly before those consequences appeared. They did not think of themselves as sick. They were active. They were functioning. They were living normal life. And yet underneath that normal life, the biological strain had been accumulating. The danger of hypertension is not that it always makes you feel bad. The danger is that it often does not. And once you understand that silence does not mean safety, the next question becomes far more serious. What exactly can years of ignored high blood pressure lead to when that damage finally catches up? When people hear that high blood pressure is dangerous, they often understand it in a vague way. They know it is bad for the heart. They know doctors care about it. They know it matters somehow. But many do not fully understand what is actually at stake. The consequences of uncontrolled blood pressure are not abstract. They are specific. They are measurably. And many of them can change the course of a person's life permanently. The first major risk is stroke. Your brain depends on a delicate network of blood vessels to deliver oxygen every second of every day. Chronically elevated pressure damages those vessels over time. It can weaken them, narrow them, or make them more prone to clot formation and rupture. When blood flow to part of the brain is suddenly blocked or interrupted, brain tissue begins dying within minutes. That can mean loss of speech, loss of movement, permanent disability, changes in personality or cognition, loss of independence. And for many older adults, stroke is not simply a medical event. It is the dividing line between independent life and needing daily help. The second major consequence is heart attack and coronary artery disease. High blood pressure increases stress on artery walls and helps accelerate the environment that promotes plaque buildup. Over time, coronary arteries can narrow. And if a plaque ruptures, a clot can form and block blood flow to the heart muscle. That is how many heart attacks occur. Even before a heart attack happens, narrowing of those arteries can reduce blood flow enough to cause chest discomfort, reduced exercise tolerance, and worsening cardiac strain. The third consequence is heart failure. Many people think heart failure means the heart suddenly stops. That is not what it means. Heart failure often develops gradually when the heart can no longer pump or fill efficiently enough to meet the body's needs. One major pathway into heart failure is years of untreated hypertension. Remember, the heart must pump against blood pressure. If pressure stays elevated long-term, the heart muscle thickens and stiffens. Eventually, it may struggle to relax properly between beats. That can lead to fluid retention, shortness of breath, fatigue, swelling, and repeated hospitalizations. And many people do not realize that blood pressure alone without a heart attack can help drive that process. The fourth consequence is kidney damage. Your kidneys filter the blood through tiny, delicate vascular structures. Those structures are highly vulnerable to chronic pressure injury. Over time, hypertension can scar them. That reduces filtration capacity, waste products build more easily, fluid balance worsens, blood pressure becomes harder to control, medication options may become more limited. In advanced cases, severe kidney failure can lead to dialysis. The fifth consequence is one many people underestimate: cognitive decline and vascular dementia. The brain is not only vulnerable to major strokes, it is also vulnerable to repeated subtle damage from long-term vascular strain. Small vessel disease can impair blood flow gradually over time. That may contribute to slower thinking, memory decline, poorer executive function, difficulty concentrating, reduced mental sharpness. People often assume all cognitive decline is simply getting older. But vascular health plays a major role in how well the brain ages. Protecting blood pressure is partly about protecting long-term brain function. The sixth consequence is damage to circulation outside the heart and brain. Hypertension contributes to peripheral artery disease and broader vascular dysfunction. That can reduce blood flow to the legs and other tissues. Some people begin noticing leg pain when walking, cold feet, slower wound healing, reduced exercise tolerance. These may seem unrelated at first, but they can reflect broader vascular damage. And perhaps most importantly, all of these risks compound each other. This is not one isolated problem. High blood pressure does not choose a single organ and spare the rest. It creates strain across multiple systems at once. The same elevated pressure affecting the kidneys may also be affecting the brain. The same vascular injury promoting plaque in the heart may also be damaging leg circulation. The same arterial stiffness burdening the heart may also worsen stroke risk. That is why clinicians take hypertension seriously, even when a patient feels well. Because we are not reacting only to the number on the cuff. We are reacting to what that number predicts over time. And this becomes more important after 60 because the body has less ability to absorb cumulative damage. Reserve is lower. Recovery is harder. Complications are less forgiving. The same uncontrolled blood pressure that might take years to create noticeable consequences at 50 can produce more meaningful harm at 70 because the body has less buffer left. That is the hidden math older adults often do not see. Blood pressure is not dangerous because of one bad day. It is dangerous because of what repeated excess pressure does over thousands of days. The good news is that understanding the risk is only useful if it leads to action, and high blood pressure is one of the clearest examples in medicine where earlier correction can meaningfully reduce future damage. The good news is that high blood pressure is not a problem you are powerless against. Yes, it is serious. Yes, it can cause silent damage. But it is also one of the most measurable and most manageable cardiovascular risks we deal with in medicine if you treat it with the seriousness it deserves. The first step is simple, but many people still skip it. Know your real numbers. Not the number you vaguely remember from 6 months ago. Not the one reading taken after rushing into an appointment. Not the estimate based on how you feel. Real blood pressure control starts with actual measurement. For many older adults, that means using a validated home blood pressure monitor and tracking readings over time. Because one isolated reading matters far less than the pattern. What your blood pressure does repeatedly is what predicts risk. And home monitoring often reveals one of two problems. Either the pressure is higher than the person thought, or the pressure is better controlled than they feared, and anxiety was exaggerating the concern. Both are useful to know. The second step is understanding that treatment is not just about getting the number down. It is about reducing long-term strain on the organs we have discussed. That means treatment decisions should be viewed through the lens of protection, not inconvenience. Many people resist treatment because they focus only on the immediate downside. I do not want another pill. I do not like taking medication. My pressure is not that bad. I feel fine without it. But medication is not prescribed because you feel sick. It is prescribed because the goal is to reduce silent damage before symptoms appear. That said, medication should never be approached blindly. If you are on blood pressure treatment, it is worth understanding why each medication was chosen, what target range your clinician is aiming for, what side effects to watch for, whether timing of dosing matters, whether your readings at home match the office plan, because adherence improves when people understand the reason behind treatment. The third step is addressing the daily habits that quietly worsen pressure even when people think they are doing pretty well. For example, many older adults underestimate sodium intake because they are not adding much table salt. But blood pressure is often affected more by processed and packaged foods than by the salt shaker itself. Bread, soups, deli meats, sauces, frozen meals, restaurant meals, and packaged snacks can all contribute substantial sodium without tasting especially salty. Sleep matters too. Poor sleep, fragmented sleep, and untreated sleep apnea can all worsen blood pressure regulation. And many people with sleep apnea do not realize they have it. They simply assume snoring, daytime fatigue, or poor sleep quality are normal with age. Weight changes, inactivity, alcohol excess, chronic stress, and inconsistent medication timing can also all contribute. But here is an important clinical point. Lifestyle matters greatly, but lifestyle improvement does not mean everyone can avoid medication. Some people can normalize pressure substantially through weight loss, diet, sleep correction, and exercise. Others improve but still need medication because genetics, vascular stiffness, kidney physiology, or long-standing hypertension continue to drive elevated pressure. That is not failure. That is physiology. The fourth step is knowing what to discuss at your next medical visit. A productive conversation includes questions like, what is my target blood pressure range? How often should I check it at home? Are my readings controlled for someone my age and risk profile? Do my kidney numbers suggest any blood pressure-related strain? Are my medications optimized for my situation? Could another condition be worsening my pressure? These are far more useful questions than simply asking, is it okay? Because okay means very little without context. And finally, understand this. Managing blood pressure is not about perfection. It is about reducing cumulative damage. You do not need flawless numbers every hour of every day. You need better long-term control than the body would otherwise face. Even meaningful improvement without perfection can reduce strain on the heart, blood vessels, kidneys, and brain over time. So if there is one message I want you to take from this discussion, it is this. High blood pressure becomes dangerous when people confuse silence with safety. The absence of symptoms is not proof that damage is absent. Feeling normal is not the same as being protected. What matters is what your blood vessels, heart, kidneys, and brain are experiencing underneath the surface day after day, year after year. If your readings have been running high, or if you have not checked them carefully in a long time, this is worth taking seriously now rather than later. Because prevention is always easier than trying to recover lost function after damage has already occurred. If this helped clarify something you had not connected before, subscribe for more medically grounded explanations like this. I focus on the kinds of hidden health risks that become more important as we get older. And I'd be curious to know which part of this surprised you most, or what about blood pressure would you like me to explain next? The most dangerous thing about high blood pressure is often not the pressure itself. It is how easy it is to ignore while it quietly changes the future.